Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumers and Radio, where we're really going to get into some good data analytics discussions and the importance of good healthcare analysis. And joining us to lead that discussion is Sean Gallivan, Chief Operating Officer with Healthentic. Sean, good morning.
Good morning, Doug.
Yeah, you coming to us from Seattle today?
I'm actually in Denver today.
Oh, you are? Okay, great. You got any snow there?
It's going away slowly.
Yeah, it is. Yeah. I'd hate to be in Buffalo. It's a good thing you're not in Buffalo. But, hey, Sean, nice to have you on today. And give our audience a little backgrounder on Healthentic, and then we'll get into some other discussions about this whole healthcare analyst finds, et cetera.
Excellent. So Healthentic's mission is to make population health measurement very easy. We crunch numbers so the employers don't have to. Mm-hmm. We help employers make the right diagnosis for their population health, and also help them see that the interventions that they have chosen are working.
Mm-hmm. How old's the company?
5 years old.
5 years old. What was the genesis of the beginning of the company?
It was a Thomson Reuters splinter group.
Oh, you were? Okay, I didn't realize that. Okay.
Yeah, we all came from Thomson Reuters. We worked on their hospital quality product.
Okay.
And we came over to look at population health.
Yeah, great.
Now, Sean, when you when you look at the importance of why businesses need to measure population health, is there a list of the top five, or is it a list of three things why they need to really measure population health across their employee population?
Well, if you're a health or benefit manager, the goal is to have a continuously improving health system. Mm-hmm. And better use of data is critical to that. So three things, I think, are big. Most employers don't even measure health outcomes right now. They settle for participation rates and things. Health-related costs are substantial, and they vary much more than I would have expected from employer to employer. So everyone has different issues. And population health management is critical for evaluating the effectiveness of the programs that people have undertaken.
Now, if I'm an employer, and my question, do you guys work with health plans as well, or purely to the employers? Is there multiple different channels there for you?
Yeah, employers and consultants are two channels.
Okay.
We get the data from the carriers.
From the carriers. Okay. So when you're looking at the employers, what are some of the biggest mistakes they make when measuring population health management inside their organization?
Oh, yeah. Well, so many employers are shooting in the dark. They don't know the details of their population. That's the biggest problem. And what that really causes are a few things. They launch programs on what they think is the biggest problem. Mm-hmm. It's usually diabetes, metabolic syndrome, but they don't really know. Many employers also measure their program success by participation, rather than looking at its impact on the overall health system. And finally, I see a lot of employers chasing last year's costs, and without data, they have a hard time getting in front of what's about to hit them.
Yeah, and you mentioned that big word, data. A lot of these employers and advisors, they get all this data, but it's a lot of data. And how would you recommend that they effectively analyze that data that they receive?
That's a big question, I think. Well, I think if you look at it by answering three questions, it simplifies it a little bit. First of all, you need to understand what's driving poor health. Call it the patterns of health determinants. What factors are contributing? Then the second question is what should you do about it? What policies and interventions will optimize your health plan? And then finally, did the interventions have the impact you wanted? Did the health outcomes improve? And, what does that mean for the next round, this continuously improving health system?
Talk a little bit, Sean, about some of the most interesting findings recently that some of your analysis point. I know you allude to the flu. I mean, talk a little bit more about some of these recent findings and the data that you've been able to report back to some of your employers.
Yeah, so Hawaii National Bank had an interesting story. They had the tool up, and they didn't realize how bad diabetes and cardiovascular disease had become in their organization. So they reached out to a local hospital system, and they asked their hospital system to engage with their at-risk employees. So the hospital system came on the ground, did this great intervention, and it was successful enough that the hospital system is using it for a pilot for other employers in the area. Another good one. I think many of us are familiar with Lincoln Industries. They've really set the gold standard for investing in wellness over the last couple of decades. Upon seeing our tool, they have taken a look at our health migration model, and they want to standardize all of their health goals based on keeping healthy people healthy, moving preventable people to the healthy category, and keeping chronics in monitoring or managing their conditions very well. And that was a real feather in our hat that Lincoln is working on adopting that goal.
Now, Sean, when you there's a lot of stuff that we're hearing about in the news around, some other disease states out there, whether it's Ebola, I don't know if you'd call it a disease state, but Ebola and some other diseases out there, is the flu, when you look at the flu, is it more costly in dollars and lost productivity than some of these other diseases that we hear out across the country?
Yeah, it's a fascinating case, actually. There's $6.2 billion per sick days because of the flu every year.
Wow.
And so there's a huge cost. 20% of your employees are likely to get hit with the flu any given year, and only about 10 to 14% are being vaccinated. Which is really interesting.
Yeah, it really is. So
the reason that's significant is it may be one of the easiest ways to realize a pretty high return on an investment. Most flu shots are covered, and if you can just engage the employees to go get them, you can rescue a lot of productivity time.
When you're looking at some of these employers who are looking to kind of combat this cost, is there any recommendations you would have for increasing the number of people who need to get vaccinated for the flu or any other type of sickness or illness?
Absolutely. Within any organization, there's probably three groups. There's a group who is interested in getting the flu shot. There's a group who doesn't much care, and a group who's not interested. And so if you make it very easy to get a flu shot, whether it's on site or coupon or a drive, then the people who want to will get it, and the people who may not be interested, you can probably get some of them. And the communication will help the people who don't want one potentially understand the impact, because the flu's not fun for anyone, and if they're hourly, they could, the productivity they lose could be their own.
Hey, Sean, for our audience that's listening right now, what's your business model? What's if I'm an employer and want to get connected with you, what's the business model?
Great question. So our business model is we aggregate, we sell directly to employers and employers' agents, brokers, and consultants. When we engage, we take all of the healthcare data we can get our hands on, and we match it by person in our warehouse. So we know the full spectrum for every single person, and we do it in a de-identified manner, so there's not a PHI concern. We charge per employee per month, and the data is updated quarterly, and with each quarter we consult and give insights around the best things they could do for their populations, and reporting on how their programs are positively or negatively impacting their group.
Do you work through other distribution networks, or you alluded to consultants? So you partner with consultants that take your service into their employer clients?
We have a few partners too.
Yep. Now, with the Sean, with the broker consultant community, is this a tool that you're seeing them pick up and take into more employers, say, from the time you launched till now? Has it been an education process with the consultant and broker community about your product?
It has, and it's been a huge differentiation for the brokers.
Mm-hmm.
Largely, the brokers use it in two ways. Some of them actually give the login to their customers, the employers, and help them manage it directly. And then there's another set that they log in and then they export the data and the findings and present it on their own, which is a huge benefit to the brokers.
Now, so the employer size for this type of solution, I assume it's the larger employers that have more employee lives. Is that correct?
Yeah, the data analysis falls apart when there's too few lives.
Okay.
We have been successful with the larger end of the fully insured market, but it's generally about 1,000 lives, self-funded and up is what we're looking at.
Okay. Well, we've got about a minute left on the program, and if you could kind of leave our audience with 2 or 3 good takeaways on why they should consider looking at your product.
Oh, excellent. Thank you. Again, stop shooting in the dark. You will be far more efficient and have a better return if you know exactly what's going on and launch programs that are much more surgical in nature. And then to be able to measure and iterate those programs as they're going on is truly important to creating the system of health that we all need in this country.
And how can they find you guys, Sean?
Go to healthentic.com. Health, E-N-T-I-C, like authentic, healthentic.com.
Hey, Sean, we really appreciate you joining us on the program today. Have a great weekend out there in Denver. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.